An abscess is a localized collection of pus that occurs as the body's response to an infection. It is often characterized by redness, swelling, warmth, and pain in the affected area. Abscesses can develop in various parts of the body, including the skin, internal organs, or other tissues, depending on the underlying cause. The formation of an abscess typically indicates the body's attempt to isolate and eliminate an infectious agent, such as bacteria, fungi, or foreign material. Causes of abscess disease. Abscesses are primarily caused by bacterial infections, with Staphylococcus aureus being the most common culprit. This bacterium can invade through minor cuts, hair follicles, or other breaches in the skin, leading to the accumulation of pus. In some cases, abscesses may also result from blocked glands or ducts, for instance, sebaceous glands in the skin or ducts in organs like the liver or salivary glands. Infected wounds or injuries. Bacteria can easily enter wounds and initiate the infection process. Foreign objects, splinters, needles, or other foreign bodies lodged in tissues can trigger an abscess. Immune system dysfunction. Conditions like diabetes, HIV/AIDS, or chemotherapy can weaken the immune system, making the body more prone to abscess formation. Types of abscesses. Skin abscesses. These are the most visible type, often occurring in areas like the armpits, groin, buttocks, or around hair follicles. They typically appear as swollen, red, and painful lumps that may feel warm to the touch. Dental abscesses. These form in the gums or around the root of a tooth due to untreated cavities, gum disease, or dental trauma. Internal abscesses. These develop within the body, such as in the liver, brain, lungs, or abdomen. Internal abscesses are less visible and may present more generalized symptoms like fever, fatigue, or organ-specific dysfunction. Perianal abscesses. These occur near the anus and are often associated with conditions like Crohn's disease or infections of anal glands. Breast abscesses. Common in lactating women, breast abscesses often result from mastitis, where bacteria from the baby's mouth enter through cracked nipples. Pilonidal abscesses. These occur near the tailbone and are often caused by ingrown hairs. Symptoms of abscess disease. The symptoms of an abscess vary depending on its location but commonly include localized pain and swelling, a hallmark of abscesses, especially in the skin. Redness and warmth. Inflammation around the abscess site is common. Pus drainage. In some cases, an abscess may rupture, releasing foul-smelling pus. Fever and chills. These may occur if the infection spreads to the bloodstream, leading to sepsis. Fatigue or malaise often accompanies abscesses, especially internal ones. Diagnosis. Diagnosing an abscess involves a combination of physical examination and diagnostic tests. For skin abscesses, a doctor may inspect the affected area and palpate it to check for fluctuation, a soft, fluid-filled center. For internal abscesses, imaging tests like ultrasound, CT scans, or MRI are often required to locate and assess the abscess. Treatment options. The treatment of abscesses depends on their size, location, and severity. Common approaches include drainage. The primary treatment for abscesses is draining the pus, which relieves pressure and allows healing. For skin abscesses, a small incision is made under sterile conditions. Internal abscesses may require surgical drainage or minimally invasive procedures like needle aspiration under imaging guidance. Antibiotics. While antibiotics alone may not always resolve an abscess, they are often prescribed to control the underlying infection, especially if the abscess is large, recurrent, or accompanied by systemic symptoms. Pain management. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can help alleviate discomfort and inflammation. Home care. For minor skin abscesses, warm compresses can help promote drainage and healing. Keeping the area clean and covered is crucial to prevent further infection. Complications of untreated abscesses. If left untreated, abscesses can lead to severe complications, including sepsis, a life-threatening condition where infection spreads throughout the body. Fistula formation, abnormal connections between organs or tissues can form, particularly with perianal abscesses. Spread of infection, abscesses can grow larger or spread to adjacent tissues and organs, worsening the condition. Chronic abscesses, some abscesses may persist or recur, requiring more aggressive treatment. Prevention. Preventing abscess disease involves minimizing the risk of infection and maintaining good hygiene. Some preventive measures include proper wound care, clean and cover cuts or scrapes promptly to avoid infection. Good oral hygiene helps prevent dental abscesses. Manage chronic conditions, keeping diseases like diabetes under control can reduce susceptibility. Avoid sharing personal items, towels, razors, or needles should not be shared to prevent bacterial spread. Conclusion. Abscess disease, though common, can lead to significant discomfort and complications if not promptly treated. Recognizing the symptoms and seeking appropriate medical care is essential for effective management. With proper hygiene, timely intervention, and medical support, most abscesses can be successfully treated, leading to full recovery.
Thank you for watching. Please subscribe our channel.